Starting with the name of Allah, who is the most merciful and the most beneficent. Assalamu alaikum. Welcome to my channel, The Smile Squad. In this video, we will learn about the mental nerve. Mental nerve is the branch of the inferior alveolar nerve, which is the branch of the mandibular nerve. The mental nerve provides sensation to the lower lip, chin, and surrounding tissues. As we can see in this picture, the inferior alveolar nerve. The mental nerve is a branch of the inferior alveolar nerve. After entering the mental foramen, we called it mental nerve, and when this nerve reached the anterior teeth region, then it is called the incisal nerve. Mental nerve block. The mental nerve block is the type of the local anesthesia that numbs the surrounding lip, chin, and surrounding tissues. Areas anesthetized. The areas anesthetized by the mental nerve block are lower lip, chin, buccal mucosa. Buccal mucosa means anterior to the mental foramen, and facial gingiva means anterior mandibular teeth, incisors, and canines. The nerve targeted by the mental nerve block is mental nerve, a terminal branch of the inferior alveolar nerve. Mental nerve can be used for dental procedures involving the lower lip, chin, or lower incisors and canines, or soft tissue surgeries or trauma repair in the anterior mandible region. The mental nerve is contraindicated in patients with history of allergy to local anesthetics, patients with certain medical conditions such as bleeding disorders or severe cardiovascular diseases, bleeding disorders like hemophilia or hematoma formation at the injection site, or the patient having the cardiovascular diseases. If we inject the local anesthesia in patients having the cardiovascular diseases, it can cause the changes in the blood pressure due to the vasoconstrictors present in the local anesthetics. Patients taking certain medications such as anticoagulants or MAOIs, monoamine oxidase inhibitors. These are used to treat the depressions. If it is injected in the patients using the monoamine oxidase inhibitors, it can lead to the adverse reactions. The advantages of the mental nerve are it is effective for the lower lip, chin, and lower incisors and canines. It is easy to administer and minimally invasive and quick onset. The disadvantages of the mental nerve block can be paresthesia or the nerve damage. Paresthesia, it is the abnormal sensation as the numbness, tingling, burning, or prickling. It can be due to the nerve damage. Hematoma, it is due to the vessel damage, and it may not provide adequate anesthesia for all patients. The alternatives of mental nerve block are infiltration anesthesia or the nerve blocks of adjacent nerves such as the inferior alveolar nerve or the lingual nerve. The target area of the mental nerve block is the mental foramen, which is located in the anterior surface of the mandible. The landmarks of the mental nerve block are the mental foramen, lower border of the mandible, and the canine tooth. The technique for administering the mental nerve block is approach from the buccal side of the two premolars and inject near the mental foramen, which is located between the two premolars and mesial to the second premolar. The area of insertion for the mental nerve block is the mental foramen. Precautions that should be taken when administering the mental nerve block are using the sterile needle and syringe, monitoring the patient's vital signs, and avoiding the intravascular injection. The onset and duration of anesthesia for the mental nerve block are: onset, the numbness start from 2 to 5 minutes and the duration lasts up to 1 to 2 hours depending on the anesthetic agent. The signs and symptoms of the successful anesthesia include numbness in the lower lip, chin and lower incisors and canines, and loss of sensation in the anesthetized area. Failure of anesthesia include the incorrect needle placement, insufficient anesthetic solution, anatomical variations or premature contact with the bone. Accessory innervation to the lower lip, chin and lower incisors and canines can from be the inferior alveolar nerve, the lingual nerve and the myloid nerve. Inferior alveolar nerve provides sensation to the lower teeth and surrounding tissues. The lingual nerve provides sensation to the anterior two-thirds of the tongue, and the myloid nerve provides the motor innervation to the myloid muscles and the anterior belly of the digastric muscle.